Hi, I'm Dr. Umamaheshwari. Now I'm going to discuss some next based model MCQ questions. Move on to the first question. A 25-year-old male from Caucasian population was suffering from depression due to loss in his family, was taking tricyclic antidepressants. He developed symptoms like inappropriate talking, delusional beliefs, auditory hallucination. Which of the following antipsychotic agent is contraindicated in patients taking tricyclic antidepressants? The option given are fluoxetine, haloperidol, quetiapine and olanzapine. So from this question we have to take it. It is given as Caucasian population is already on TCA, that is tricyclic antidepressant. One antipsychotic is going to be added. So among this option which is contraindicated? The answer here is haloperidol, because tricyclic antidepressants, they are substrates of CYP2D6, CYP3A4, CYP1A2 and CYP2C19. About 7% of the Caucasian population has CYP2D6 polymorphism. This polymorphism is associated with slow metabolism of 2D6 substrates. So, tricyclic antidepressants being CYP2D6 substrates, they have slow metabolism of tricyclic antidepressants. When you combine an CYP2D6 inhibitor with tricyclic antidepressants, it will lead to toxicity of tricyclic antidepressant. So, among the option given, option A is fluoxetine, which is also an CYP2D6 inhibitor, but it is an antidepressant. Option B is haloperidol. It is an antipsychotic agent which is a CYP2D6 inhibitor. So, when haloperidol is combined with tricyclic antidepressants, it will lead to the toxicity of tricyclic antidepressants. The option C is quetiapine, that is metabolized by CYP3A4. The option D is olanzapine, it is metabolized by CYP1A2. So from this question we have to remember haloperidol, it is CYP2D6 inhibitor. Caution should be made when it is combined with tricyclic antidepressants, because it will lead to TCA toxicity. And the reference here is from Katzeng. And moving on to the second question. It is an assertion and reasoning based type of question. The assertion: non-selective beta blockers are more efficacious than beta 1 selective blockers in glaucoma. And the reason given is ocular beta receptors are predominantly beta 2 subtype. Option A is if both assertion and reason are true and the reason is the correct explanation of the assertion. Option B is if both assertion and reason are true but reason is not the correct explanation of the assertion. Option C is assertion is true but reason is false. Option D is assertion is false and the reason is true. And the answer for this question is both assertion and reason are true and the reason is the correct explanation of the assertion, because betoxolol, it is a beta 1 selective beta blocker. It is less efficacious in lowering intraocular tension than timolol, which is a non-selective beta blocker, because the ocular beta receptors are predominantly of beta 2 subtypes. And beta 1 selective blocker, they have an advantage of less bronchopulmonary, less cardiac, less central and less metabolic side effects. And also these beta 1 selective drugs, they exert a protective effect on the retinal neurons independent of the intraocular tension lowering effect. But the more efficacious drug is non-selective beta blocker. So the reference is from K.D. Tripathi. And we'll move on to the third question. A 60-year-old patient with a history of COPD came to the OPD with the complaints of breathlessness. He was administered a drug by nebulization which aggravated the symptoms of glaucoma. Which of the following drug is likely to precipitate glaucoma? Option A is ipratropium bromide. Option B, tiotropium bromide. Option C, sodium chromoglycate. And option D, ketotifen. The answer is option A, ipratropium bromide. Because nebulized ipratropium bromide may precipitate glaucoma in elderly patients due to the direct effect of the nebulized drug on the eye. This can be prevented by nebulization with a mouthpiece rather than a face mask. This problem has not been described with tiotropium. So, ipratropium bromide has a propensity to cause glaucoma in an elderly patient when a drug is given through the nebulizer. And option C, sodium chromoglycate, the adverse effect of this drug is it causes bad taste and it may causes bronchospasm. Rarely anaphylaxis can occur with sodium chromoglycate. Ketotifen, they will cause sedation and dry mouth as its side effects. The reference is from Goodman and Gilman. And the fourth question, name the drug which is used for the treatment of an extrapyramidal disorder causes this adverse effect. So the extrapyramidal disorder includes Parkinsonism, akathisia, dystonias, etc. The option given here is rasagiline, ropinirole, amantadine and levodopa. So the adverse effect here is livedo reticularis. Livedo reticularis, it is a bluish discoloration and edema of legs, occurs due to local release of the catecholamines causing post-capillary vasoconstriction. This side effect is mainly caused by amantadine. So the option A here given is rasagiline. It usually causes involuntary movements, and ropinirole, they will causes compulsive behavior disorders. It is mainly behavioral side effects is common with ropinirole. Amantadine, they will causes livedo reticularis. And with levodopa, the side effects include postural hypotension, abnormal movements, behavioral effects, arrhythmias and exacerbation of angina will occur. And the reference is from the Tripathi 8th edition. And the fifth question is, a 60-year-old man came with the complaints of dribbling after urination, sense of incomplete bladder emptying. A drug has been prescribed to overcome the dynamic component of the obstruction, and the one which has prostatic apoptosis promoting property is. The options are doxazosine, tamsulosin, yohimbine, finasteride. The question they have asked dynamic component and also which has prostatic apoptosis promoting property. So the answer is doxazosine. Alpha-1 adrenergic blockers, they are used mainly to relieve the dynamic component, while 5-alpha reductase inhibitors are used to relieve the static component. So from the options, option D, it is an finasteride, which is an 5-alpha reductase inhibitor. It relieves the static component. So we can exclude the fourth option. So among the three, which relieves the dynamic component and which has apoptosis promoting property? Option 1 A is doxazosine. They have apoptosis promoting property. And also the another drug, terazosin, they also found to have apoptosis promoting property. Option B, it is in tamsulosin. It lacks the apoptosis promoting property. The option C, it is yohimbine. It is an alpha-2 blocker. So the answer here is doxazosine and also terazosin. They relieve the dynamic component and also they have apoptosis promoting property. This is references from K.D. Tripathi. Thank you.